Hi, everybody. I'm Ryan Smith at Sign. I work in the fundraising and communications department, and we're here today talking with Jeanne Dillner. She's our CEO. And we just want to chat kind of about what's going on in the world, what's going on at Sign, and what's going on with you so that we can just see that we're in this whole process together and see where we go from there. So how are you doing today, Jeanne?
I'm doing pretty good. I'm right now I'm in my home office. I kind of split 50-50 each day at Sign because I want to be there for the production staff who get to work. And then it's actually a little easier to get some of the other kinds of work that I do done here from my family room. So that's where I am today, looking out at my garden, and it's lovely.
Yeah, so working from home here as well. So how are Wally and Jilly?
My two dogs, Wally and Jilly, are fine. They're happy to have me home more often. And one of them's at my feet, and the other one tried to be there. So
Yeah.
for the time being, they're just snoozing. How about your puppy?
We have two dogs. They're always under either my or my wife's feet constantly today. So they're getting severely spoiled.
Yeah, it's going to be really traumatic for them when we have to go back to work all the time.
For sure. Speaking about that a little bit, here in Washington State, we're under a stay-at-home, stay-safe order. But because Sign is a medical device manufacturer, we're considered an essential business, so we can stay open. But how is all this affecting Sign?
Well, it's affecting it a lot better than I had thought it would. I was really concerned for the patients that we serve that we were going to be closed, and I had a sense that it would be, they keep doing 2 or 3 week closures, and I had a sense that it would be that way based on what I'd seen and watched in China and Italy and other countries. So I was very thankful that our governor, in our country, the governors get to decide how to proceed with protecting the people of their state. And so our governor decided that medical device companies were essential, and so we were able to stay open. Our staff in that department are able to make nails and screws and instruments for the Sign surgeons, and our shipping department have been shipping actually more this year than we had last year to make sure that our Sign surgeons have the equipment that they need. So we're very pleased about that, happy for our staff because they have a job, and happy for the Sign surgeons because they can do their job with what we provide them, and most of all, very elated that the Sign patients are still able to get their legs repaired should the hospital that we send to still be working on orthopedics. I know in some places that we've learned that they've had to put a pause, just like they did here, on what's considered elective surgery. To me, having a broken bone would be something that would be an emergency, but in these types of times, making sure that the patients who are severely ill with COVID are the most important priority. So we understand that, and we're thankful for the Sign cases that continue to be reported, and it really isn't that much less than it was a year ago. So we're encouraged by that.
Yeah, that's great. Speaking of from Sign surgeons, have you been hearing from some of them? Is there any themes or something that's come through from what you're hearing from them?
Mostly the theme is, like in our country, the concern for the safety of the medical workers, because it's hard to know if you're working on a patient that has been exposed or has the disease. So a lot of, especially 3 weeks ago in the Philippines area, we saw a lot of them working really hard with volunteers to get the personal protection equipment. We know of some in Pakistan who have been, the doctors themselves have been confirmed with COVID. So of course we pray for their healing and protection for the rest of our friends and Sign surgeons. And in Africa, it's just beginning. And we've seen, again, the innovation of using materials that you have to create the personal protection equipment is phenomenal. And we're excited to, as we see these things, we share them with other sign surgeons so that they can incorporate those ideas in their own hospital and region that they live in.
Wow, that's great.
Mm-hmm.
That was not great news, but great
Mm-hmm.
that we're hearing from the science surgeons and working together for that, for sure.
Mm-hmm. Yeah, of course, we pray for them, and we're hoping that we all come out of this and get to attend the sign conference in 2021.
Yeah. And speaking of the Sign Conference, there's some changes going on this year. Can you tell us a little bit about that?
Oh, yeah, we made what I call a thoughtful and difficult decision given the length of time it was predicted that this virus would be spreading around the world, and the fact that it's very difficult to get flights and very difficult, even more difficult to get visas to come into our country, we decided that this was the year that we would take a vacation from the live sign conference and move to the digital format. So we're excited about this. We don't have exact dates of when we're going to do it, but we plan to incorporate a combination of U.S. surgeons and sign surgeons from overseas to be our faculty, just like always, and trying to find a time of our day that translates well to a time of sign surgeons day that they would be able to attend. It would not be an 8-hour day conference. It will be much fewer hours, but we were incorporating a live portion of it as well as putting other teaching and faculty in video format on what's called the hub. So there will be plenty of information that will be shared with the sign surgeons about this as the summer progresses, and also it will remain up on the hub, the Sign Surgeons Education Center, if you will, for digital learning. And it will remain there and ready and available to them for always once we get the materials put together and get the sign conference for this year going onto the hub.
Yeah, and hopefully even more surgeons can get involved this way since they don't have to traveling here to the U.S. But yeah, it'll be different and a learning experience for all of us for sure.
Right. Yeah. Yeah. And we are very much missing already conceptually not being able to see our friends. But the one big benefit to all of this going digital is that more sign surgeons will be able to see the materials firsthand. And we're excited about that opportunity and look forward to having more sessions like this in the future.
For sure. With all the changes and working from home and all that kind of stuff, what's something you've learned through this whole process?
Well, I've learned how to use digital technology, and I know our staff are amazing, but I have to say that everybody has been incredibly accommodating, and they've all learned how to use digital imaging, digital communication technology to communicate with each other and outside of sign as well. So we're all being very flexible and trying not to be impatient, and in some ways maybe communication might be better. I don't know, because you're really making a point of it, whereas if we're all in the same building together, you just, I can talk to them tomorrow. But now you really have to just make an appointment and have the conversation, and I think in many ways we're maybe slightly more productive. But I know it's hard on our staff though, because it's the unknown that's really a challenge, and then there's the looming, boy, what if somebody gets sick? Those kinds of things, because we're all doing our best to stay 6 feet away, and even when we're in sign, we're all wearing masks and sanitizing our hands constantly, just as has been recommended. And I know our staff who are working from home are doing the same thing. Yeah, being very responsible.
Yeah. Yeah, we're definitely learning a whole lot of new tools, but yeah, it's been interesting to see how I think you mentioned there, in some ways that we might actually be more productive and having some space to concentrate when we need it and having
Mm-hmm.
dedicated time to talk through what we need to with our teams.
Mm-hmm. I know that Lori's done a great job of having meetings with you and the rest of the team every day, and then we have our once a week meeting. But I think it's important to have that face-to-face communication because it's almost like being together in the building, almost.
Oh, yeah.
Yeah.
I know it's very difficult and it's easy to get focused on the news and scary things, but what's something that's encouraged you this week?
This week? Um, you know, I guess to be encouraged is to think, for me, it's still the joy I get from seeing the talent of our sign staff um, and to hear from our sign surgeons, the ability to use your creativity to make life better for others is very rewarding and almost as rewarding when you see others doing it. So, but this week we have um, local people that have been supporting sign in the past few weeks with making cloth masks for the employees and with providing other sorts of personal protection for our staff and others so that and even one of our Chinese vendors sent masks for the shop personnel to wear and just donated them to us along with thermometers so that we're able to make sure that those who come into work are fever-free and are able to protect each other from the droplets. And so it's encouraging how humans who are caring and compassionate, they don't only do that to people of their own country, they extend it way beyond. So we're very grateful for that.
Yeah, that's great too.
Mm-hmm.
So Sign's vision, just to kind of circle back to it a little bit, is to create equality of fracture care throughout the world.
Mm-hmm.
Why is that vision, why is that mission important right now?
Well, it's a vision, a mission, but it's also a culture. The Sign family, it consists of our volunteers who help make masks because they were concerned about us, our Sign employees and the Sign surgeons, and also our board and other U.S. doctor volunteers. Everybody comes together at the Sign conference and soon the digital Sign conference to share a willingness and a desire to use science to improve the health of a human being that they'll never get to meet. And so we continue with that. We think of the sign surgeons as our brothers and sisters. So the fact that we're praying for them and also trying to find other medical support that they need during this time that goes beyond just the sign mail, we're doing our best to provide additional things for them. So especially ones that have very little access to these additional items. So we're doing what we can to further maintain and protect the people who are the hands of sign, the ones that are actually doing the surgeries. So it's a mission that's kept all of us, I think, united, even though we're apart, all of the sign employees, because we went apart so that we would keep the ones who had to work at sign healthy. And now those that have to work at sign are keeping each other healthy by wearing the masks and taking their temp, etc. So yeah, it's just pretty amazing to have, to be able to have, it's really an honor really to have the kind of job where you know everything that you do, whether you do it inside the sign building or outside of it, is to help a human being in a poorer situation than you be able to walk or to be able to stay healthy. So it's a wonderful feeling.
Yeah, it's a wonderful thing to be part of. I mean, we call it the Sun family all the time, but it's easy to see that in a time like this, that we're coming together and working and sharing ideas and finding new and different ways to support each other.
Mm-hmm. Exactly. Yeah.
Yeah. Well, we're running kind of long, so I don't want everybody to watch us for too long, but I just want to say thank you for chatting with us again.
Sure.
And if anybody has any questions or things they want to know about sign, feel free to leave a comment, and we'll try to address that in another video with some other people who sign, or direct those questions to who can appropriately answer that.
I
So,
think some of the people that are watching this today would like to know that Dr. Zirkle is doing fine, and he's of course sheltering in, and the only problem with that is that he has just too much more time to dream up more big ideas that we have to implement. But thankfully, we're ready to help, and he's communicating a lot with sign surgeons around the world. And so anyway, he's doing just fine, and he would say hi if he was right here too. So.
all right. Well, thanks a lot, Jeanne, and thanks everybody for watching us, and we'll see you again soon.
Thank you. Bye-bye.
Bye.